Constipation can be much more than just a slow bowel movements. As per Ayurveda, constipation is a signal of Vata imbalance and blockage of channels. A patient with depression or rheumatoid arthritis usually has constipation as an associated symptom. A patient with migraine can also have constipation. In some cases, relieving constipation can contribute to relief in the migraine and depression as well. Even though it is a simple discomfort, but if not treated on time or if neglected, it may lead to major problems. So, there is an immediate need to look into this health discomfort seriously. In constipation, the waste products are stuck inside the large intestine. Due to those stuck waste products, there will be complications. In fact, the reason is much deeper than that. The large intestine is designed to store feces for a certain amount of time. Holding it for some more amount of time is not a big task for it. The real problem is lack of bowel movements for a long period of time sends wrong signals to liver, brain and immune system, leading to migraine and such other complications. Dosh responsible for constipation. Vata dosh is divided into 5 subtypes, namely Pran, Udan, Vyan, Apan and Saman. Among them, Apan Vata is responsible for the free flow or expulsion of stool. When the functions of Apan Vata are significantly affected, it results in the constipation. Causes of constipation: intake of food possessing dry, light and rough qualities. The food that causes dryness of mouth, lightness in the body and roughness in skin. Excessive consumption of pungent, astringent and salty foods. Night awakening. Less intake of water. Working in strong sunlight. Long walk. Heavy traveling. Sitting at the same place for a very long time. Lack of sufficient fibers in diet. Neurological disorders such as Parkinson's disease. Excessive use of antacids. Depression. Rheumatoid arthritis. Pregnancy, in which the fetus putting pressure on the intestines, causing lack of bowel movements. Colon cancer. Intestinal obstructions like structural problems such as twisting of intestines are the leading causes of constipation. Pathology of constipation as per Ayurveda. Due to these Vata imbalancing factors, Apan Vata is aggravated and it is blocked in the lower part of large intestine, which results in the constipation. Depending on the grade of affliction, absolute constipation or hard stool are complained by the patients. Complications of constipation. If the complaint is neglected for a long and causative factors are further continued, then hemorrhoids, fissure in ano, gaseous distension of abdomen, bloating, hard stone-like feces, headache, liver disorders, and various metabolic as well as intestinal diseases may be originated. In few of the individuals, backache and reverse peristalsis are also found. Line of treatment in constipation. Internal oleation. Administering 5 to 10 grams of cow's ghee or medicated ghee is very useful in the treatment of constipation. External oleation. Oil massage with sesame oil is very helpful to treat a constipation. Use of soft laxatives and suppositories. Tips to prevent constipation. Include fibers in your diet. Lots of fruits, vegetables, legumes, cauliflower, raisins, cabbage, berries, green leafy vegetables, beans, guava, flax seeds, spinach, orange and mushroom. Consider eating fruits and salad as a part of your lunch or dinner. Drink good amounts of water throughout a day. Consider that in a normal person, Ayurveda advises to drink water only when thirsty. But in a disease condition such as constipation, one can have good amounts of water. Water along with the fiber-rich diet softens the bowels and prevents the constipation. Avoid excess of coffee and tea. Some people will not get a bowel movement urges unless they have their coffee or tea. This advice is not applicable to them. If you are feeling constipated, consider cutting down on milk and dairy products. Do not sit at a place for a longer period of time. Consider walking or jogging for at least 15 minutes in a day. Do not hold any kind of natural urges. As per Ayurveda, a natural urge is a signal for a person to act. It needs to be attended immediately. Regular holding of natural urges eventually will lead to constipation. Avoid excessive spicy food, heavy, non-veg and fried food. In short, drink 2 to 4 extra glasses of water in a day, unless fluid restricted. Try warm liquids, especially in the morning. Drink a cup of warm water in the evening. Consider getting an oil massage or do it yourself. Treating the underlying cause. In case of depression, apart from constipation, depression symptoms should be treated. In case of IBS, where constipation is an associated symptom, in a few cases, correction of digestion process should be given due importance. In case of migraine and rheumatoid arthritis associated with the constipation, the disease should also be given due attention in the treatment. The herbs which are useful in mild constipation: haritaki, aragvad, draksha, patol, katurohini and castor oil. The herbs which are useful in severe constipation are jaipal, danti and trivrut. Home remedies for the constipation: soak 10 to 15 raisins in water in the morning and consume it at night. 1 teaspoon of cow's ghee should be dissolved in 1 cup of warm water. 1 spoon of sugar candy can also be added and taken during bedtime. This is highly effective against mild constipation. Those who pass the bowel like hard pellets, gulkan is administered during night time along with the milk. The fruit pulp of aragvad is taken along with the water or milk. This helps to relieve even chronic kind of constipation. Tender leaves of castor are taken and ground into fine paste. Into this, pulp of aloe vera is added. Consumption of this paste helps people who frequently suffering from constipation. Regular use of aloe vera pulp in diet prevents the hard bowels. Yoga for constipation. Pavan Muktasan and Uttan Padasan with other asan and exercises that put pressure on the abdomen are very useful in the treatment. Medicines that causes constipation. Ayurvedic medicines which containing gugal and shallaki as ingredients may contribute to constipation. Allopathic antidepressants such as amitriptyline and imipramine, anticonvulsants such as phenytoin, carbamazepine, iron supplements, antacids with the aluminum may causes constipation. In such a patients, usually Trifida powder is administered to nullify the side effects. Caution for laxative usage. Overuse of a laxative for a long period of time eventually worsens the constipation. And when you prescribe a medicine for constipation, be proactive to change your lifestyle and dietary habits so as to prevent the dependency on medications.